Now, when jaundice is left untreated for long periods of time, it is very toxic to the cells in a baby's brain. As a matter of fact, it's toxic to the cells of anybody's brain, talk much less of a baby. So you want to get jaundice addressed. Hello, moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi. If this is your first time here, you are most welcome. I am a maternity nurse and a mother of 4 who believes that every woman, no matter where she finds herself in this world, should be armed with information to help her be successful in her pregnancy, postpartum, and child rearing journey. If you haven't done so already and would love to join this community, make sure you hit the subscribe button and then turn on your notification bell so that you are made aware of every time a new video is uploaded. Now, as you can tell by the topic of this video, I am going to be discussing some common conditions that a lot of newborns deal with. And today's topic is about jaundice. Now, before I jump into today's video, I want to go ahead and put a disclaimer here. This video is not meant for you to use it as medical advice. Make sure that you do not self-diagnose with the content of this video. Instead, work with a doctor who understands your child's health care needs and history so that when a plan of care is created, it addresses your child's specific needs. And without further ado, let us jump right into today's video. Now, I've had a lot of moms reach out to me and ask me about jaundice. So today I'm going to break it down into its parts, its causes, and some of the ways that jaundice is treated. So what exactly is jaundice? Well, jaundice is the yellowish tint that usually shows up in a baby's eye, on the baby's skin, and in a baby's mucous membranes. Now, that yellowing of the skin is because of a waste product known as bilirubin collecting in your baby's bloodstream. When babies are first born, they are now responsible for breaking down their own red blood cells, their own meals, everything. Unfortunately, newborns still have immature livers, and their liver is not able to process it as well as an adult's liver. So for the first few days of a baby's life, he or she deals with a slowdown in the breaking down of bilirubin. And because the bilirubin amount increases in the bloodstream, it kind of gets pushed out into the tissue, or you begin to see it in the baby's eyes as the yellowish tint, because bilirubin has a yellowish tint to it. Now, for some babies, they may deal with some underlying type of disease that will increase the likelihood that they will deal with jaundice. And I will describe what some of those underlying causes are in a different video. But babies with these underlying disease causes have an increased chance of jaundice because their liver has to work a lot harder to break down those red blood cells that accumulate in their bloodstream. So what are some risk factors for dealing with jaundice? Well, right off the bat, a premature baby has a higher risk of dealing with jaundice than a baby who is more mature. Even mature babies have livers that need to mature a little bit more after they are born. So imagine how much more immature a premature baby's liver is. Babies who are born premature have to do way more work to break down bilirubin in their bloodstream, increasing the likelihood that they will deal with jaundice and more severe types of jaundice. Another risk factor is if your baby had any kind of birth injury. If your baby was hurt during birth and that those red blood cells have to be broken down, like if your baby had to be born with forceps, or your baby ends up with something called a hematoma, then your baby's body has to break down those red blood cells, which causes your baby's jaundice level to kind of creep up a little bit more than is typical. Another risk factor for dealing with jaundice is when moms and babies have different blood types. Mom, if you think back to when you were pregnant, your doctor may have asked you what type of, or they may have checked, instead of ask you, they check what blood type you are. Now, moms who are O negative tend to be candidates, are candidates for a shot known as the Rogam shot. And that's because if a mom gets pregnant from a man who's a different blood type than she is, and she's O negative, then her body will make antibodies against her baby's blood if her baby's blood matches the father of the baby's blood. blood, and the father's blood is not the same as the mother's blood. So if both mom and dad are O negative, then the woman does not need Rogaine because she cannot make antibodies against her baby's blood. But if mom is O negative and her baby is A positive or B positive or AB positive or whichever group type does not line up with O negative, then mom will make antibodies and attack her baby during pregnancy, and the baby is just going to have red blood cells build up all over its body, and you got to break down red blood cells, so your baby's chance of developing jaundice is a lot higher than babies that their mom's blood does not attack their own blood. Now, how can you check to see if your baby is dealing with jaundice? Well, that's pretty direct, and nurses and doctors will show you how to do this in the hospital. So you want to check in the white of your baby's eye. If your baby's eye is nice and clear, then it is usually assumed that your baby is breaking down bilirubin out of his or her body at an efficient manner. We also use a machine in the hospital to tap and check the levels of bilirubin that is present in a baby's body based on how old that baby is at that present time. So if your baby was born at 38 weeks and is 2 days old, then we calculate it, and that will tell us what a normal window is for the level of jaundice your baby is okay to have. And that's how we test to make sure babies are doing okay. But if your baby's levels are higher or beyond that window, then your baby is going to be checked a little bit more than, just allow your baby to break things down on his or her own. Another thing that you want to do is you can use your finger and press down on the tip of your baby's nose. When you blanch your baby's nose, you should see a little clear and then the blood to flow back. But if you blanch your baby's nose and you see a little yellowing, or you look in the under part of your baby's lip and you see yellowing, that's known as the mucous membranes, which is the inside of the nose and the undersides of their lip. If you see yellowing in any of these parts, then you want to let your healthcare provider know that your baby may be dealing with jaundice. Now, there are some things that moms can do to help their baby deal with jaundice a lot better, and that is to feed your baby a lot. Jaundice is removed from the body when your baby breaks down bilirubin, and bilirubin is broken down as your baby digests food. The more your baby poops, because feces is one of the most effective ways to get rid of bilirubin out of the body. So the more your baby poops, the lower those jaundice numbers begin to fall. It can also be flushed out through your baby's pee, so you want to keep your baby well hydrated. And when babies are born, they are dependent on a liquid diet. So it's very important that you are feeding your baby, if you are breastfeeding your baby, every 2 hours, 2 to 3 hours on the clock. Do not skip feedings. If your baby is dealing with difficulties breaking down bilirubin and you're skipping over a feeding, you increase the chances that your baby's blood level of bilirubin will rise. If your baby is formula fed, you want to make sure that your baby is getting 1 to 2 ounces in those first few days of life regularly. At least every 3 hours, you want to give your baby 1 to 2 ounces of formula. Now, as your baby begins to get a little older, he or she may want a little bit more. The most important thing to focus on is that you are feeding your baby adequately so that he or she is urinating and having bowel movements frequently to get rid of that jaundice out of their body. Now, if your baby has yellowing of the eyes and experiences any of the symptoms that I'm going to list here, you want to get your baby to your healthcare provider as soon as possible. Some of those signs include listlessness. Listlessness is just, your baby is just uncomfortable. Your baby just cannot seem to get it together and rest okay. Also, if your baby is extremely tired, that's something you want to keep an eye on. Babies sleep a lot during the day, so it's hard to catch that one. But moms begin to learn their babies within the first couple of days. Dads too. So if you notice any change in behavior in your baby, make sure you note it down and call it to the attention of your provider. Also, if you try to feed your baby and your baby's suck is weak, like he or she would rather sleep than eat, that's also a sign that bilirubin levels may be climbing into atypical or higher than expected levels in your baby's body. You want to make sure that you get your baby to the doctor as soon as possible so that they can check the bilirubin and jaundice level. Also, if your baby spikes a really high fever, or you have a temperature that will not come down, get your baby to get seen. That's a sign that jaundice is getting pretty out of control in your baby's body. Now, when jaundice is left untreated for long periods of time, it is very toxic to the cells in a baby's brain. As a matter of fact, it's toxic to the cells of anybody's brain, talk much less of a baby. So you want to get jaundice addressed as much as possible. Feed your baby frequently. It has been suggested that you expose your baby to sunlight so that it can help with the breaking down of jaundice. But the most effective way is adequate nutrition in your baby. If jaundice is not treated, it can cause permanent brain damage. So make sure that you are watching your baby, that you are feeding your baby, that you are getting your baby sufficient vitamin D, and that you are working with your healthcare provider if your baby's jaundice is not getting resolved in a normal time, so that other things such as phototherapy, which will be done in a clinical setting, can be initiated in a timely manner to prevent further or any damage in your baby. Now, if you have learned anything from the content of this video, be sure to give it a huge like or thumbs up. And then if you know somebody who can benefit from it, share this video with them. Also, make sure you hit the subscribe button and turn on your notification bell so that you can join this growing community of empowered parents and learners who are active participants in their own healthcare. I wish you a pleasant parenting journey, and until the next time, be blessed.